So the opportunity for me to welcome on stage Mr. Jacques Boschung from Swiss Medical Network and CEO at Halborn to talk about unlocking efficiency and quality of care through data-driven innovation. So welcome, Mr. Boschung.
Thank you so much.
The stage is yours.
Thanks for having me. Good morning, everyone. It's a pleasure to be here today. Actually, I'm here in another capacity than what is written here. I am the chairman of Wellgesundheit AG, and this is the main part, the lion's share of my presentation today. But I have also a fourth capacity. I am the chairman of Blue Factory Fribourg, which is an innovation park. So I'm a little bit in competition with what Raphael was presenting. And our number of employees on site has moved from 60 10 years ago to 700 today. 2/3 of that, 3/4 of that being from the private sector, SMB and startup, and 1/4 being academic. So you are also welcome on Blue Factory. So I had to say that. I'm sorry about it. Yeah, so indeed, today I want to speak to you about harnessing the power of data to really improve economics and value-based care. And today we are speaking about healthcare. So I will start my presentation by giving you some insight in what is called value-based care. Because it's all about value-based care. Every initiative we take in terms of care delivery, if it's not geared toward value-based care, it's for the sake of nothing at the end of the day. And we heard about prevention, we heard about a better approach to the patient journey, and this is what value-based care in general, which is a general concept invented back in the days in the United States. This is what we really thrive when we apply value-based care. So value-based care has 5 pillars. At the top of that slide, you see PCP, primary care provider. It is the access to the system. Access is a big challenge in Switzerland today, as most of you know. The second thing, it was also mentioned in the Deloitte presentation, is the empowerment of the patient. They said, CEO of your own health. I'd say that patient has to become responsible to drive his whole patient journey and become accountable as well for what he is doing. The third concept is incentive system. And here we are, I would say, this is really when the shit hits the fan, excuse my English. Because the incentive system we have in Switzerland, in many European countries, is completely screwed. We have this fee-for-service that will never work. We can never impose or make value-based care happen if we don't move to value-based incentive system, like capitation, combined with incentive for quality. That's the third pillar. The fourth pillar is quality assurance. So quality is the name of the game. How can you have trust in healthcare if you don't drive quality, at least in Switzerland, to the same level, which is very high, that we have today? So that's the fourth pillar. And none of this can happen, and we have seen that in the chart of Deloitte as well, none of that can happen without a data-driven approach, where we combine the data from the different key players of healthcare, not in silos, but we foster interoperability and we combine them. So data is the name of the game. Without data, nothing is happening. So let's speak about the digital health market for a while, because you will say and you will see that the data we have plenty. So that's the digital market. A little bit back in 2022, but those numbers are still valid. So healthcare is generating 1/3 of every single new data produced in the world. Healthcare, 1/3 of that. It's doubling. The volume we produce in healthcare is doubling every year. First thing. Second thing, application. I have always a smile when people are coming to me as a member of the board of Swiss Medical Network. Oh, we have discovered a fantastic new app. Every year, close to 100,000 new healthcare apps are released. I will be very provocative. Applications do not matter at all. What matters is data and data interoperability. Imagine 500,000 applications are freely available in the marketplace today. It's a very sizable market. 2030, we speak about $600 billion market, so absolutely very attractive, a lot of unicorns, so it's generating a lot of traction. And there is a big but. 5%. That's the last line of that slide. Large institution, starting with us, Swiss Medical Network, we spend only 5% of our top line in IT, in leveraging that data. We are not doing the right thing. That's one of the lowest level. It's the second lowest level per industry, way beyond financial services, whereas we produce more data than in financial services. So that's a big issue. And on the next slide, I will show you that we can really create value, so value-based care, and improve the economics of healthcare if we use that data. Are there medical doctors in the room? Any medical doctor? Okay. So forgive me, you will not like the next slide. Okay, so at Swiss Medical Network, we launched the first integrated health system in Switzerland. Réseau de l'Arc, that's the name. That's in the Jurafuss, so pied jurassien, pied de l'arc jurassien. And there, we have an integrated system combining our partner, Visana, health insurance, together with a hospital, and together with the canton of Bern, we have been extremely innovative with regard to integrated health system. To prepare for that revolution in healthcare, because again, it's based on capitation, remember, value-based care. To prepare for that revolution, we ran a data analytics pilot to check what we were able to do with the hospitals we have there, with the so-called Medizentren, and how can we combine that data to get to actionable insights, which is a key name if you think about healthcare. So on that chart, what do you see? You see a chart about heart failures in Arc Jurassien, in Réseau de l'Arc. On the x-axis, you have the provider, so the medical doctors. On the y-axis, you have two curves. You have the blue bar. The blue bar is the length of stay after a heart attack or a heart incident. And the yellow curve is the risk score. So what is the risk score? Who knows what the risk score is? Anyone? That's frightening. Okay, so what is the risk score? The risk score is a measure of a risk of a patient given his comorbidity, given his patient history, given his social determinant of health, age, administrative data. And that is used in Switzerland, that's the so-called Risikoausgleich, but it's intensively used in US managed care to measure and in fact to define for a given cohort of patients what is the risk score. So what do you see on that slide? So you see if you go far on the left, that you have people with a low risk score. So the higher the risk score, the more comorbidity you have. Low risk score, very long stay in hospital. Is that correct? Probably not. This is hurting the economics of healthcare. But you see also for the provider number 22, very high risk score, very short stay in hospital. Quality of care. Most probably there is an issue here. There is a safety issue basically linked to that. So that's just one small illustration on how we can leverage the data to provide better economics and better quality of care. Interestingly, if you focus on quality of care, you generate better economics. So those things are tightly entangled, and this is where the healthcare system should set its focus. So I said in the beginning, I am here also as chairman of Weltgesundheit AG. So you see on that slide, on the top right of that slide, that we are an initiative driven by the largest health insurance company in Switzerland, CSS. They are really at the outset. They were there at the outset of the application. We are also backed by other investors, which are Visana. You heard about Visana in the previous slide. Swiss Medical Network, obviously, and other players like Galenica, the largest logistic and IT provider for healthcare in Switzerland. So it's a very strong, I would say, consortium which is backing Weltgesundheit AG. And what we do, we offer to our users an individualized application to manage their health, to manage their patient or member, if they are member of one of our health plan journey. So it's individualized, it gives steering, it can steer you depending on the health plan you are enrolled with, And it's providing a lot of convenience, like booking your appointments, like storing your health data. For the one of you who are aware about the failure of the dossier électronique du patient in Switzerland, we have 10 times more dossier électronique du patient in our application because we are currently at 320,000. And how we see ourselves as being a platform and not being an application. You heard my comment about the 100,000 application. So we have different use cases. You can hear me again, I guess, so I don't need to shout anymore. So first use case, early detection and prevention. We run more than 70,000 of those early detection prevention in our app for our users. As I said, 340,000 users. And tomorrow, we will be able, thanks to this AI engine that you are embedding into the system, again, AI is as good as the data it's sitting on, we'll be able to provide recommendation which will be based on the specific health plan of the user. And we will increase our ability to make the steering. So early detection and prevention is one. The second one is really a big thing, in my view. So an app should have instant feedback system, which is one thing, and this is what we have already. And we are running more than 150,000 so far of those health guide view, which help, in fact, the user to navigate our system. But in the future, what we really want to do, we want to use the app for patient-reported outcome measure, you know PREMS, patient-reported experience measure, and potentially also for CROMS, for the clinical personnel. Meaning that on that very single app, you will have the full journal of the experience of what the patient or the member has experienced with your health system and how they have been behaving so far. And that's really the next frontier where we want to go to. Last but not least, access. You remember value-based care, the first line. Access to the system is one of the biggest challenges we have. In Switzerland, it's a huge challenge to access to the health system. I had an accident 10 days ago. I tell you, thanks God, I knew the medical doctor. Otherwise, I don't know where I would be. So it's difficult, okay? It's challenging. So we do smart triage, thanks to a symptom checker, and then we can drive directly to telehealth or not telehealth the patient. So it's really contribution to the patient journey. And in the future, we believe that we'll be able to drive predictive analytics to warn the system or to warn the patient. Last but not least, this application is also meant to provide value to our sponsor, to the people, to the owner of the application, the health plan and the health system. And the value we can provide is to help them develop customized, personalized health plan, so insurance policy for the different users based on their behavior and based on their risk score. Remember the concept of risk score, and based on the level of quality we expect. So we will have an integrated AI chat that will be also the interface between the health plan, the provider, with our application to have access to the patient and to have access to the member and the users of the application. So as a conclusion, and that will be my last slide, so you understand that we are harnessing the power of data by getting information from all those different sources. Again, without that, our application would be pointless. That's a key thing. And by doing so, we are leveraging a better triage and a much better navigation. We are also creating vaccination in the future and medication adherence. You know, 50% of the re-hospitalization are due to poor medication adherence. How do you do that? An app is the best solution you can imagine. We are running campaigns with life science company to increase the adoption of generic, again, within our very tight legal framework in Switzerland. We can have tailored insurance, so health plan offering for our user. They are doing that already. And we are a natural, I would say, repository of every health experience, of EHR, of everything linked to the health of the patient, to the health of the user. So this is what we do. And in the future, because today we are a little bit in the blockchain space, and I am also CEO of a cybersecurity for blockchain company. But in the future, we believe that our interface, our user experience will be entirely AI-based, which simplify massively the utilization. And we also believe that the sheer notion of self-sovereign identity, which is a blockchain concept, which is supported by a decentralized ledger technology, DLT, is the future. But it requires a lot of legal framework adoption in Switzerland, and we are not yet there. Thanks for your attention.